Joining us on the show is Dr. Shane Murphy, a professor of psychology at Western Connecticut State University, who is the head of sports psychology for 7.5 years with the U.S. Olympic Committee. He's the author of 4 books, including The Cheers and the Tears, a healthy alternative to the dark side of youth sports. Welcome, Dr. Murphy, and thanks for joining us here on GameTimeCT.
Thank you. Nice to be here.
Well, Sean, you want to dive right in there?
Yeah, dive right in. Well, the dark side of youth sports, I mean, this is a dark time right now in sports. There's been a lot of kids are having a tough time. Now, we don't know what exactly to do here. And a lot of parents and a lot of people who would like sports to be played say the psychology of it is concerning to them. We'd like to just kind of speak to that. In the middle of a pandemic, we saw the CDC a month ago or so put out a report that depression has gone up during this pandemic with young men and women, and sports is a big part of their lives, and that's right now, especially for the football players in this state, has been is kind of in limbo right now. You can see a lot of the emotions from parents, students, and people alike about this issue. So. What do you see as the main concern from your angle during this pandemic?
Well, as a psychologist, I'm always concerned about mental health issues in sport, and it's nice to see them being taken more seriously and people being more proactive, I think, in addressing those concerns. Thought it was really interesting just the other day, Dak Prescott, was doing an interview and talked about how very anxious and depressed he got immediately after the pandemic started. And look, this is a really confusing, anxiety-producing time for all of us. I mean, we've not been through anything like this in our lifetime. So, unfortunately, what do we know from stress? And I've been teaching this for 30 years. Like, the most stressful thing for humans is uncertainty, right? When we don't have answers, and this is an uncertain time. There's no clear answers. We're working our way through this gradually and starting to find, a solution here, a solution there, piecing it together. But nobody has all the answers, and we can't predict the future either. We are still right in the middle of this. Starting to get hopeful there, seeing the cases go down nationally for a few weeks, and now they're starting to go back up again. So it's like, when is this going to end? We don't know. So of course, I think young people are going to be really susceptible to those issues just as much as adults. And they're probably going to be picking up on the adults' insecurities and anxieties as well. So I can understand the anxiety that's out there, and especially about going back to things that they love doing, like sports.
Yeah, I mean, we're obviously, this is a high school sports-centric podcast. And a lot of people are looking at the survey that Sean spoke about and talking about mental health issues. And, my introduction to sports psychology was at college at Southern when I took that elective my senior year. And it was just so new to me, where I was like, holy, like, this is actually real. And it was kind of right around the time when professional sports started to take it seriously as well. So I've always, kind of thought of myself as someone who was, kind of pro that and in very much support of taking care of mental health sports wise. Now it seems like it's really kind of picked up, and I view, you see a lot of people use it as a reason why we should have sports. And I'm kind of stuck in the middle where I'm like, yeah, I get that. I totally understand that parents and coaches say, like, the mental health of the kids are important, and it really is. But does that supersede the potential rise in cases? Like, how are we supposed to, like, weigh everything? You know what I mean? Where it's like, mental health is really important, but also people getting sick is very important. What is more important? I don't think that's easy to say, but it's just this conversation with the tugging and back and forth of what's more important when they're both really important.
No, absolutely right. And I've taught health psychology now for about 25 years. And so one of the things that I think is really important here is health issues in general. And public health at a time like this, again, one of the complicating factors is the uncertainty, right? And we don't know exactly the best ways to proceed. We're piecing that together. Here in Connecticut, I think we've done a pretty good job. Our rates of transmission are among the lowest in the country. And that's to do, I think, with being a pretty well-educated state and people really getting on board with social distancing, protective use of equipment, and so on. So to me, as a health psychologist, we want to follow those guidelines and try and keep the rate of transmission down and the new cases of positivity way down. Because what we've seen in other places around the world, if you can get the cases down really low, you can start to open up and do things again. And sport would be one of those things that you can start to do much more safely when the virus is not spreading wildly in the community. So in terms of which to put first, I think health comes first, right? We all look out for each other with the health. And if we can get a handle on that and get control of that, then we can start to do some of the things that are more important for our mental health and psychological well-being. In the meantime, I think we've got to look at other things that we can do. And frankly, with physical activity, there's a lot of alternatives out there than just playing organized youth sports right now.
What would your advice be to parents as they try to navigate all the bad news? They obviously, parents very emotional about their kids' opportunities, and they've driven a lot of the discussion here. Should this go or not go? Well, how do they talk to their kids and being able to present them with a good foundation for them to deal with these issues?
Yeah, it's a great question. I have so much empathy for parents. In that book that I wrote, I talked a lot about how parents are in a really difficult situation emotionally with youth sports, right? Because here's the thing that they love and value most in life, their child, who's out there in this competitive situation. It's very, very public. So everybody gets to see your successes, your blunders, your failures, and how can you not, as a parent, be really emotionally involved and attached in a situation like that? And then now, bam, everything's stopped and it feels like it's being taken away. So again, parents are really emotionally stressed out about that. So, one of the things I've been talking about with colleagues and families that have come to me and asked about this is, the same advice I would give somebody if you were going into like a counseling session. When you're speaking with your children, just be really open to hearing what they think about it, right? Because they've got their own thoughts, their own feelings about this. And the parent has to be the parent. They have to put aside some of their own emotional attachment and their own emotional investment and hear what is the young teenager or preteen thinking about this situation? How do they feel? What are they worrying about? And really addressing some of those, being a really good listener.
A lot of parents have been concerned, especially ones of older children that are athletes, I should say, that a big thing is it's their moment, their senior moment, maybe for seniors, their time to get the scholarships or at least try and get noticed. And it seems to me that they put that more important into, and it might cloud their judgment a little bit on what might be important for public health. I think public health officials have been trying to convey that, listen, this isn't really about individuals getting this, but it's more about mitigating the community spread. I mean, what's something that they can do to kind of, understand that? But again, I totally understand their position on it. Like this is unprecedented times. How do they kind of deal with that themselves?
I know, honestly, I think for all of us, there's some grieving that we need to do. It's just like, it's that emotional process when you lose somebody you love. Here we're losing things that we love. Like you said, like the rituals of society are so important for our psychological well-being. And those have all just like vanished this year, and some of them may slowly start coming back, and we're starting to see some of it, but some of these things are going to take a while. So as we talked about, we can really get a handle on this and understand it better and reduce the uncertainty. I know for myself, we have a graduate program at at Western. This was our first class ever of graduate students in addiction studies, and they were going to graduate in May, and I was going to be there to cheer them on when they walked across the stage, and all that just vanished. And I felt like crying. I still do. It's like it was awful. And I think we just have to realize that this is going to cause some real hardships while it's ongoing. And it's okay. It's okay to grieve about those things. It is really sad.
Yeah, you mentioned grieving, and I think that's actually a great word, because I've always been trying to, Sean played some high school sports. I played some high school sports. I didn't make every team that I ever tried out for. Trust me, I am the worst basketball player in the history of the world. And I had two uncles play D1 ball, and I didn't get any of those teams. I got cut from basketball teams. I got cut from baseball teams. I got cut from all these other teams. So now everyone knows how terrible of an athlete I am. But you grieve when you don't make the team. And I'm not saying that them getting their season taken away is the same thing, but we're seeing this pushback, which I'm all about, these athletes standing up, using their First Amendment right, the rally at the Capitol, all that. I get that. But at what point is it kind of healthier, maybe mentally, to just be like, okay, this is a roadblock. This is something that has come up in my life. How am I going to work to get past it? How am I going to make myself a better person, by like pushing through and powering through this obstacle in my life?
Well, I think that's certainly one option. Again, I would say, look, there's no one size fits all answer. People are going to, some athletes are going to take that really public, proactive approach, but I'm sure there's other athletes that are like, they're like, maybe this is a good thing that this is happening this way. So again, I just really emphasize listening to each individual as a family, as parents, and working through this. And unfortunately, right now, it's just dealing with reality, right? Like the officials are not going to change their minds, I don't think, based on what we want, right? They're going to try and make public health decisions. What's best for the safety. We were going to start back up at Western Connecticut 2 weeks ago. Everyone was ready to move in, and on that Friday night, Mayor Boughton and the state said, no, we've got a spike of cases here. You can't move your students back in, and it got postponed 2 weeks. Now it looks like, we're moving back in tomorrow on Saturday. So we just have to deal with reality
at one of the things I'm a little concerned about is somehow that, you talk about there's a grieving process, but there's also like the anger. They talk about the stages of grief. There's the anger where how concerned are you or psychologists about how the anger involved in having something out of your control be forced upon you, and basically I've seen a lot of people put any argument they can find, sometimes even bad ones, sometimes even ones that are misinformed, out there, and it seems to really kind of rally people up. And how do people navigate that? That seems to me a really important part of this.
Well, you're quite right. Like, there's a lot of emotions bound up in this, and as I say, it's unprecedented. I think if we went back 100 years to that 1919 flu epidemic, we'd find people that would understand what we're going through right now. But otherwise, no. None of us have ever dealt with this. So I think anger, yep, absolutely. People are experiencing that. Anxiety, we've talked about. Depression. I think some people are really, really down and feeling like really unmotivated. And I think with all those, you have to deal with it again by acknowledging it, and then listening and processing it, hearing people's concerns. If people are really, to take your point, like upset, and maybe they're sort of lashing out a little bit, we talk about diffusing situations like that, right? You're trying to like meet them where they are and say, look, I understand your concerns, right? Here's what's happening. This is why this is being done. How do you feel about that? What role can you play constructively in dealing with this situation? Because, as I said, some things you can change, but there's a lot of things right now that none of us can change. So the anger is understandable, but what are you going to do with that in a positive way to deal with this situation?
A lot of this reminds me, and Pete wasn't around, but a lot of this reminds me of the 1980 summer boycott. The 1980
Oh,
summer boycott in
Olympics?
Moscow,
Yeah, that was so
the
hard.
Olympics. I knew Gene Mills, who was a wrestler at Syracuse University, who was going to go to the Olympics. There were a lot of stories coming out how angry and how upset, and the things that the athletes threw around at the politicians about how that their dreams were taken away. A lot of those, that was their only shot. You must see that, and I was younger, but I do remember that. Do you remember that? And when what did people do then?
Oh no, I remember it. In fact, when I worked at the Olympic Committee, there were many athletes around at that time. This was the late 1980s, early 1990s, that had been through that. Right? I had a sports psychology intern that was one of the great divers in the USA that was robbed of her chance of Olympic gold because of that 1980 boycott. My personal opinion, that was way too political. That was a decision that probably shouldn't have been made. But again, you're right. Athletes had to deal with a lot of that same anger at not having control over something that they worked so hard towards being taken away from them. And again, some people went into real depression and anger and were really down about that. But those who've done best, like my intern, Megan, they took the positive approach of how can I pick myself up from this setback, learn about resilience and applying myself in other areas of life now that particular goal and dream of mine is no longer possible to fulfill.
What can schools do? Is it something schools should really, again, we don't know if football is done yet, but I mean, the roller coaster ride has really been a big concern. Kids don't know. They feel like they're helpless. They did go to the Capitol, which I thought was a tremendous thing. But what can schools do? These kids, if they don't have a football season, these kids are going to be sitting on the sidelines or they're watching some of their other kids play. What can schools do to try and help these athletes out?
That's a good question. I mean, I think one thing, again, is this is not so much really sports psychology, but just general good psychology is communication, right? You try to be as transparent as possible. As I said, this is uncertainty, and the schools are also dealing with that. They have never had to make these sorts of decisions before, and it's based on sometimes limited information. So the more they can say, look, here's the situation, these are the facts that we have right now, this is what we're being told, right? And I think they're trying to do that. I think they really are, but they just got to really keep communicating clearly, because when it becomes a situation, people are like, I'm not getting the full picture here. What's going on? Like, I'm not hearing the story. That's when a lot of the really, the conspiracy theories, the anger that you were talking about can start to build, because people feel left out of communication. They feel left out of the dialogue. So I think that's probably one thing they can do. As I said earlier, I think, I'm a huge proponent of physical activity and sport being a wonderful, positive thing in life for the promotion of our just mental well-being. And I would emphasize that, like, if the football team, for example, is not able to play right now, we don't know if they can play till maybe next spring. What else can you do? There's what other activities? Maybe you can do some of them together as small groups. I'm still playing tennis, but I only play outdoors and I only play singles, which is a bit of a stress on me right now at 62. But I'm still having fun with it, But I used to love playing doubles indoors, but I just can't do that at the moment. So, what other alternatives are out there to keep that physical activity and that little bit of that competitive drive satisfied? Maybe schools can put their heads together and think of things to recommend and help with in that way. I don't know. I'm just thinking off the top of my head.
Yeah.
I mean, a big thing that we're hearing from coaches and players is that lack of transparency, which, depends on what side you're on, or, what you view as them being transparent or not. But a big thing that they're saying is that, like, you told us to do this, we did this, and now you're still telling us no. I feel like that's a big thing that the coaches and the athletes are saying is like, well, tell us what number you want and we'll get that number. I don't think it's that easy. It's not it's not a math problem. You know what I mean? You can't just have an answer and then, it's done. But I feel like that lack of transparency is what's really kind of brewing a lot of this. Because even today, or on Friday, where they had the press conference at the state capitol, a lot of people were tweeting at our reporter being like, okay, but they didn't answer this question. They didn't answer this question. I feel like that is something that is really kind of brewing this whole thing of these angry responses and just straight up anger. I mean, that's a lot of what I see is just a lot of anger, and I get some of it and I understand it. But at the same time, there's only so many things that the CIAC can do. When it all said and done, they answer to a higher power than just, the coaches and the superintendents.
Yeah, and there's no universal answer, right? Like the Big Ten is on pause as far as I understand it at college, but I think it's the SEC is going ahead, So, and you're right. Look, there's no math answer to the problem, but I do think being transparent about goals is a good thing. I think one thing that as a public health person, with a lot of background in epidemiology, what I've been hearing about is trying to get below the R naught, 1% positivity or less. And our problem here in Danbury the last few weeks has been about 7% positivity. So that's not a good thing. So, is that something that we're striving for, to get it down to a certain low number of positivity? And if that was the case and we were able to keep that through the whole state, are we able to maybe go back to some of these things? Is it possible that we'll have football in the spring if that is the situation? I would hope that there is at least some communication around those sorts of goals going on.
Yeah. Is there, I guess the broad thing here for me, Doctor, is, I feel like parents need to, maybe try and, as much as they want to advocate for the kids, maybe try and take themselves out of it and maybe listen a little bit more and try and get the most kind of information. Kids, need to look at this, try to find a positive way to deal with this. Going forward, we've heard it from the CIAC as well, that say, listen, I think there's a lesson to be learned here. And I think I said this at a graduation, but I think this is one of the things, if you can survive this, a positive message is you can probably survive anything, at this point. You've been through the worst. You could tell kids going, years from now, look, I survived 2020, whatever you're going through right now. This may not be ideal for them, but I think, in a positive way, it could really, affect, if they choose to do this. Again, this is, it depends on where they go psychologically. I think they can use this in their development as adults, into adults. What do you think? And, and is that an important message to convey?
No, I think that's a great message for young people, right? That's something I stress all the time in health psych is resilience, right? How do you bounce back and learn to bounce back? We're all learning messages and lessons here about, what do you do when everything seems to be going against you, and to be honest, I've been encouraged. I've seen a lot of really good things out of young people. Some of the social efforts that have been going on have been driven a lot by young people, with awareness of things like climate change, racial equality, social inequalities, and so on. So I think people are perhaps taking advantage of a time when they have opportunities to reflect upon bigger issues and doing something with that. So I think that's a great message. And I also like your other message, for parents, something I had, my kids are now in their 30s, but when they were little, is taking your own emotions out of the situations. Because as I said earlier, right, it's hard, it's your loved one out there and you care so much about them. But in the long run, it's not about you, And I've heard from so many parents, like, 20 years later, I look back and I was like, why did I get so upset and wrapped up about, kids' sports? It seems really important at the time. And there are aspects of it that are really good and valuable, but we have to take ourselves out of the equation and do a really good job of meeting the needs of the young people. What are we doing for them at this point in time?
Yeah, absolutely. Another thing I thought of, and this is something that's really kind of stuck with me. I don't think our generation, or maybe, my generation, their generation, maybe yours, had to deal with anything like this. My grandparents, they had to deal with World War II, and they might have dealt with the depression. You know, and before that, there hasn't been anything like this, right? I mean, you know, I know my parents' generation, they were always scared of maybe a nuclear war happening. And there was Vietnam, which was similar, but it didn't disrupt like the daily life that this is now. So, I mean, you see something there. This is something that, you know, we're not used to in this country.
No, but, you know, I am older, you know, so my parents, my father's passed away, but I used to talk about this with him. He was a teenager during World War II, and that is the nearest equivalent. In fact, I think, you know, that was a lot worse. You know, the people were dying by the tens and hundreds of thousands, you know, and every day in the early 1940s, it was bad news. You know, you woke up and you read the newspaper, it was like how far the Nazi line has advanced today.
Right.
It looked really bleak. And I talked about it with, you know, my wife's parents, how they adapted and bounced back from that. And they're looking at this COVID virus as, yes, it's a really a negative thing, but I don't think for them it rises up to that level of what they experienced.
Right.
So, you know, maybe we can look to that and say, hey, you know, it's bad, but it's not that bad. You know, let's be thankful here. You know, like one great thing is like we have this technology, right? Can you imagine this pandemic 20 years ago when we didn't all have cell phones and Zoom? And
I did so many puzzles, and let me tell you, I am not good at puzzles. They took 2 times as much as they probably should have. And then I'll be honest with you, I lost power a couple of weeks ago with the tornado in Hamden. And when the sun was out, I was like, this is great. I'm off my laptop. I'm not on my phone. And then once it got dark and I was sitting in my living room, I was like, what do I do with myself? Like, oh, it's 8:30. I guess I'm going to go to bed because there's nothing else in the world to do.
Right.
Get a flashlight out and read a good book.
I had a candle, but if you get close enough to the candle, then the book goes on fire. And, you know, then not that I don't have power, then I have a fire in my apartment. So, but like you guys mentioned, like kind of the long term and how to, you know, be resilient, like use this to be resilient as you get older. But what are some of the long term negatives to come out of this if these kids don't get to play? You know, obviously you want them to become resilient and learn from it and, you know, use it to better themselves in life. But that, unfortunately, the case is that's not going to be everyone. You know, and there are going to be people who are going to hold this grudge for a very, very long time. You know, everyone, you know, the song Glory Days, right, by Bruce Springsteen, he's talking about his high school days. Like, people do that. Like, you go to a bar, you run into someone like, hey, man, back in 88, your boy was a stud. And, you know, like, what are some of these, like, ramifications going to be for some of these kids as they become adults if they don't get this season?
I've actually been talking about that with my students at West Park because I'm teaching a freshman seminar class. So they were all high school students. A lot of them went to Danbury High this spring. And one thing I would say is don't hold that grudge, right? That's the worst thing you can do. You gotta let it go of the things that, again, are outside of our control and focus on the things that are under our control. And I'm actually seeing some really positive signs from those young people. You know, they've been able to look at this, as you said, and see, like, what are some good things? Like, a lot of them are saying, like, I feel a lot better with my family right now. You know, we've been able to talk about things. We've been able to do more things together. I mean, I don't know if you've seen it in communities, but it's like, you know, local parks and tennis courts and baseball fields. You know, you see a lot of families out in the evenings right now, which is a wonderful thing. So, yeah, I mean, yeah, maybe you've lost a high school senior year in sports or a freshman year, but that's no reason to take that and turn it into something that you hold close as a negative. No, you got to let that go and look for the positive things that you can do from here on, learning from that experience.
Yeah, I mean, I've gone to some parks. I've gone hiking, big hike guy, a lot of trails, and everyone's like waving at you. They're all like, hey, and I'm like, people are really nice right now.
People are great in Connecticut. Like, you know, there's certain hikes that I do that are really busy. You know, people will put their mask on if you get too close, you know, and they take it off again as soon as they're, you know, more than 6 feet away. And it's like, it's so nice, you know, people being so supportive of each other right now.
Yeah, it's pretty. And I'll be honest, you know, I live in Hamden, and, you know, maybe like once a week, I'll try to like get, you know, food from like a local place or, you know, a small restaurant or a small bar that has food. And like, you go there and it's like pretty packed, and it's either people don't want to cook, people don't want to go to the supermarket, or they just want to support their local businesses. I think that's great. even outdoor eating has, I mean, I love outdoor eating anyway, but like, you know, that's obviously taken a big tick up because a lot of people don't want to sit inside. And you're not close to people, but you're still like kind of having conversations with them, people you've never spoken to. And I could talk to anyone, let me tell you that. But it's got this nice feel now when you're like you run into someone at a store, you give them a nice little wave, a little head nod. It's kind of nice.
Yeah, look, I have a lot of optimism. Humans are very adaptable. We've adapted to all sorts of challenges in our brief history. And this is a big challenge for sure, but we'll adapt. And I think there'll be things that will come out of this that we'll all do for the rest of our lives now. It's like, I'm not saying that, we have to, this is the new normal. No, we want to get back to a lot of the rituals and things that we really love. But there's going to be things that we adapt and change and learn that we're going to stick with. I think.
That's a good way to kind of lead off here. Dr. Murphy, thank you very, very much. We appreciate you having on, giving us a little insight into this. It's very, very difficult issues, obviously. But to talk us through this, I guess that's what good psychologists do. We kind of talk it out. And I think that's an important thing a lot of people need to do. And we appreciate you giving us a little time here today.
Thank you. Thanks for having me on. I enjoyed it.
Absolutely. Thank you so much. We really appreciate it. And good luck with everything. And stay safe. And I'm going to find my words eventually. So.
Thanks.
All right, doctor. Thank you.
Thank you.